Ayun Otiak, the Vice President of Sudanese Mothers Coalition in Victoria, Niel, Communication Officer, Sudanese Mothers Coalition, and Agai Wit, the Community Engagement Officer, Sudanese Mothers Coalition in Victoria. We have Wendy joining us, who is the psychotherapy or counselor for Center for Migrant and Refugee Health. And we also have myself, Ayen, Community Engagement Coordinator at Center for Migrant and Refugee Health. So this project is funded by the Department of Health Victoria. The aim of this project is to raise awareness about COVID-19 and seek options on lived experiences from parents, families, and young people. So COVID-19 is still existing and people need to take precautions. The weekly data show a decrease of 29.4% from the previous week. The average daily number of new cases this week was 492, down to 702 last week. In the past 3 months, 5,986 COVID-19 patients were hospitalized in Victoria. Of those hospitalized, 41.2% had not received their third vaccination dose, and 30.8% were unvaccinated. Of Victorians aged 50 to 64 years, 80% have had their third dose and 32.2% have had their recommended fourth dose. Of those over age 65, 90.9% have had their third dose and 68.4% have had their fourth dose. 70.5% of people aged 16 and over have had 3 doses. A total of 149 COVID-related deaths were reported by the department in the past week. An average of 21 deaths were reported each day for the past week. This represents a 6.3% decrease when compared to the same period the previous month. The total number of reported COVID-related deaths in Victoria since the pandemic began in 7,116. This includes 173 historic COVID-related deaths, which occurred between March 2021 and June 2022. These deaths were added as a result of the department's regular data auditing process. So, welcome again to the session. I would like each and every one of you to introduce yourself and say hi, and then we will begin by asking questions mainly about what experiences we're facing with COVID-19 as parents or as people in the society. So can we start with Monica Majak?
Yeah, good afternoon, everyone.
Just wait.
My name is Monica Majak, chairperson of Mother Foundation in Victoria. Thank you.
Yeah, just wait. Please wait. Yeah. I'm sorry about the interruption. Yeah. And Ayun Otiak?
Mommy. Don't take my worksheet.
I'm a deputy of Mother Coalition in Victoria. Thank you.
Mommy, don't tell it.
You go to the toilet, please.
Mommy,
Okay.
come with
And
me.
Yep, just wait 2 minutes.
I need to come with me.
Sorry, guys. Sorry, I'll join you in 2 minutes. Just continue with the introduction and I'll join you in 2 minutes.
My name is Agawid. I'm a board director for Mother Coalition. Thank you.
My name is Wendy. Hi, everyone. I'm a psychotherapy or counselor and a supervisor. I supervise counselor as well. I work with a group and individual supervision. So I'm a mental health worker as well.
Daniel.
Okay, so it's my turn here. Hi everyone, my name is Nia Ajo. South Sudanese Communication Officer. So thank you. I'm telling you.
Okay. Okay. So what experiences are we facing in the society or as parents with COVID-19?
Would you like me to talk about people what they're facing, or everyone here has his own experience?
I think more about everyone's own experiences and then, yeah, about other people too. But what experiences we have experienced with COVID, like personal experiences.
Yeah.
Okay, I will start. Yeah. As I said before, my name is Monica Majak. Uh, I can say good afternoon again. And yeah, the question is good, Ayan. The experience of COVID 19, we experience as a parent in Victoria. I myself, I was just get sick in 1 month ago. I was being infected by COVID 19. And
Yeah.
the experience as I faced this time was very high. The way I got COVID 19 was really very, very, very bad because first when the COVID uh, catch me first, it was not that severe, but the second one was really very severe uh,
Yeah.
because the pain I got in my body, I didn't experience last time. So what what actually we use, especially in South Sudanese community, what it help a lot is uh, what I know is like when you got COVID 19, you can get confused first, but in what we use, what I used in COVID 19 when I got sick, I used to have a lot of hot thing, like I drink a lot of coffee
Yeah.
with ginger and ginger with lemon,
Mm-hmm.
and also we have madida, which is a forage. We use that,
Yeah.
and also used to have a lot of influence, like drink a lot of hot water, and that one will help a lot. So
Yeah.
when I get sick this last month, uh, all the test has gone. I got sore throat. I got all the 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 symptom. I got all the symptom for COVID 19, which is I did not get
Yeah.
last time. When I get sick last time, I didn't get any symptom. But the second one, I got all symptom, and I was really, really very, very, very sick. So what helped me, although I didn't get the taste in my mouth, I drink a lot of hot thing, including
Yeah.
soup. So I just have soup, just normal fresh soup, and then I drink it. So when I get sick, also I got in our community we got good in helping each other. So I got one of my neighbors used to bring me a porridge and hot soup, and then I make myself a drink because sometimes I call my daughter to bring me a hot thing inside. So those are the things I have experienced a lot in the COVID 19. Uh, Plus isolating myself in my room. I
Yeah.
didn't come out. From the very first day that I got the COVID 19. It was bad day for me, and it was good day because that were the time my son came out from the prison. And
Yeah.
what was happening actually, I just went to bring my son from airport, and when I came, I was really feel sick. But the good thing, what happened, my son came and he took Uber, came home, and then I went to
Mm-hmm.
airport. When I called him, I didn't get him. So I just came and I give him hug. When I came, I met him still waiting outside. And then I came, I give him hug. And then he came in and I went through to my room because I was, all my joint pain was paining a lot. So I went inside to my
Yeah.
room and do the test and I found myself was positive. So I just called them outside and I told them I'm not gonna come out again because I'm very positive now. Nobody coming to my room, and I have to isolate myself. So I isolated myself actually like 8 days. I was inside, so I didn't come out. So after I I find it become good, and then I just came out. Yeah. So it is
Yeah.
actually for our community to do the test when you feel it's good to do the test in order to help other people. It's good to do the
Yeah.
test whenever you feel sick. Don't ignore it. Don't say it's normal, normal flu or something like that. It's not normal. Sometimes you can say you can ignore it to say it's normal, but it's not normal. So we have to do the test and isolate yourself, and then do all the routine that you can do in COVID-19, like uh, wash your hand all the time, especially when it's sneezing. Like this time, I was being sneezing a lot, and then whenever I sneeze, I clean my nose and I went to wash my hand. And yeah, doing those routine is very important. It helps you, even you yourself, when you sneezing and touch your face and even your mouth, you will get like your nose is itching. You feel it straight away, like your nose is itching. But if you wash your hands straight away after sneezing, you cannot feel anything. So I
Yeah.
just like to tell my community that COVID-19 is still with us. It did not go away. When you feel it, please, you have to isolate yourself, and do all the routine of the COVID. Like we know now, a lot of people aware about COVID-19. Like when you get infected, you should test yourself, isolate yourself, and be there until the COVID-19 gone. You can feel it when you don't have COVID-19 because even though you test yourself again, you will still see it, you still affected unless after 18 weeks, something like that, and then you will not feel the COVID-19 in your body. But even though you feel like 7 days or 8 days, 2 weeks, even 14 days, you still be having COVID-19 in your body. The virus is still there infected, but it's not going to affect any other people. So it's good
Yeah.
for us
And
to let ourselves.
yeah.
Yes. Thank you.
And just to add to that, like sometimes when you take a rat test, if you continuously taking it, most of the time will turn out negative. But if you keep on testing, it'll be negative, negative. But then if you test again the fifth time, it'll be positive. So I think continuous testing also is another way to know and then to isolate yourself and keep yourself safe and keep the community safe. Yeah. So
That's
also,
correct.
Monica, what other? Yeah. Did you receive any external support services during that time when you were
Pardon?
isolated? Did you receive any external support services when you were isolated during that time?
Yeah. Did you get any help or support during that time?
Yeah, did you get any
Yeah,
Did you
help or
yeah,
receive?
support from
I get
external
support.
services?
Yeah, I get
Okay.
support by that
Yeah.
time. I get support.
Right.
Yeah.
Because this is the only way to help you overcome the symptoms sometimes. Connecting with the community to avoid the stigma can make people because feel isolated and sometimes even abandoned. So they may feel depressed, hurt, or angry because they can't find that support. So it's so important to reach the community or reach the support that's to help you reduce the anxiety and depression, because it's not just the physical symptoms, it's the mental health symptoms, the mental the impact on your health as well. So most of the time it's not physical, the reactions. So the main things, the stress you're going through, it's a normal psychological and physical reactions to what you're going through. So everyone react differently. So people they have strong-minded, they might have control, but that virus it affect everyone, but everyone react different for this virus. So the main concern about this virus is the mental stress and the worry during the crisis. So all these things it does affect people to the point that feel people so much sick and helpless and sad and angry and irritable and hopeless. So that's why they're getting through more anxiety and more anxious and afraid actually from something will happen or horrible thing will happen. It's all about the mind and the power of the mind, how much affect people physical health. So reaching support, it's so important. Reaching community is so important, because if you isolate yourself, I work with people during the pandemic. During the pandemic, we're not allowed to work, but I was working in a clinical psychologist with people. They just want to reach someone. Even they want to reach, they came to the clinical psychologist during that time when we're not allowed to go out. But I have that's I can our job to reach these people, because people they need support. There's a lot of people they sometimes COVID-19 physically affect people and mentally, that's right. But when people have long-term stress or depression, the loneliness and the pandemic is make it worse. So affect people, trouble normal people they don't have stress or depression, long-term depression or stress. And the way you feel or you see the pandemic impact on your body, it start this image in your brain. You think like, oh my God, I might die. Oh my God, I might get more sick. Oh my God, I might happen. And that's all this impact on your health more than usual. Um, the strong-minded and the belief that's I'll be all right. I'll pass this, and it's just a little disease. I can pass it, and it's how much you have a strong mindset, how much it's reduce your physical react for this virus. Sometimes everyone's different, so we can't put everyone's the same. Yeah, so mental health, or the way people they see things or think about how the impact of the virus in their body, it's reduce or impact more than other people for this virus. So that's the important part about how much you think about how this virus make you weak and make you strong. So that's why the body reacts sometimes or to the impact of this virus on the body of the people. There's a lot of people that have long-term depression, so they come to the point they want to suicidal, because it's not just the time when they have that pandemic, but this has come from different things. But now it's going triple where they're going to, where they used to go before for depression or whatever situation they're going through. Yeah, so I'm not sure, because I can't just go on as a review or brief. It's about everyone's situation. There's a lot of people they get sick, but I know people they have cancer before, and when they have the virus, they end up in the hospital. So that stress from previous life, previous situation, physical situation, impact triple in that people. So that's why we're trying to reduce the mental health anxiety, the anxious, the fear, the worry about what they're going through, to just make him come down, to connect, to do meditation, to do something like even talking to someone, even avoid the TV, avoid all the news, because that's make you more anxious. Avoid the media. Sometimes all these things is impacting you more and more. We're trying to reduce all this media and technology to not listening to any other stuff like people, how much the percentage of people in the hospital, how much it's impact on them, and how much people died, and all these things. That's make people live in fear. So that's getting worse in the person, in mentally and physically.
Yeah.
So I can't just Just I'm
Yeah,
talking in
and to
general because I'm
also
not in the
add to that,
situation.
like
Yeah.
as yeah, yeah,
Yeah,
Yeah,
and
I
also
think I
that's
have to add.
to add to that, as like youth, like speaking on behalf of youth. Yeah, speaking on behalf of youth, sometimes it's hard for youth to reach out to people, to talk to people, because they feel like to keep things to themselves. I'm example as that as a youth and a young mom. But I would also encourage that if you can, there's also these psychologists or that you can find online or like free counseling services online that you can get online and you can speak to a professional if you are feeling a certain anxiety or depression and you don't feel it's safe to share with family or friends. You can always seek that external support over the internet. So,
Exactly. This
is
is
there
the only
anyone
way
else that
people.
has had any? Yep.
Yeah, self-care
Yeah.
is so important, and connect with people in the community. It's halfway through from your sickness and your mental health problems. So to make
Yeah, I
yourself
just
like, so to keep yourself regular routine, like maintain a regular daily schedule of important things for your mental health. For example, you connect with people. You have, it's not connect with people, even if you want to do, for example, cooking. Sometimes I ask people to do dancing, singing. It's kind of meditation.
Mm,
And sometimes ask people
yeah.
like, to I recommend them to be busy mentally and healthy, like reading book, join the things they want to do, focus on positive thoughts, like this is a temporary time, it's not going to be forever. You know what I mean? So just don't think these things will last forever.
Yeah.
So just that will be just at certain time will be finished. So always I'm supporting people to just to draw the strength and belief system that they can help them to be comfort during that difficult time and uncertainty.
yes, I just want to add something as well, Wendy.
So yeah.
During the COVID-19, a lot of romance, in the media, we just did a lot of, brainwash for the people who are supposed to have a vaccine. So
Mm,
they always, have those kind of,
Yeah.
oh, don't take it, it's not safe, you're gonna die. So
mm,
it took me a lot of time as a mother. I got my own boys, I got girls, which is adults.
yeah.
It took me time to convince them to say, this is safe. Let's go and have a vaccine because it's safe for you to have vaccine to protect yourself.
Mm,
And I have one of my son until today, he refused to have it because from what he saw, on the media and from what he wrote, it's just like, misleading people. And
exactly.
Yeah.
for my experience with my mom, I got my mom, she's almost 80. When the pandemic coming out, I have to protect her, I have to just close her door.
Mm,
I'm the only person who used to go and feed her and make sure she's, safe. My
yeah.
other kids, because they're adult, they thought that no, we don't have to catch any, COVID, and because I'm still, young. And I say
Mm,
to them, okay, if you think you're young, don't come to my mom, because my
mm,
mom, she's old, and she
that's
got
right.
health issues. So
Yeah.
I have to, to keep them away from not going at all to my mom room. And
Yeah.
then the good thing as well, we got some culturally remedies we have. I used to have in my house, and
Yeah.
I believe those, cultural remedies help a lot. Even my
Of
my
course.
girls, they
Yep.
they they don't take them, but
Yeah.
during the COVID-19, when someone got running nose and having issues, they said, "Mom, please, can I have it?" And I said, "Yeah, you can have it." So we call
Yeah.
it garat in Arabic. I'm not quite sure how to say it in English because they're not here in Australia. It's an African,
Yeah.
South Sudanese or Sudan thing. It's very nice. We always try to just warm it up, cook it. It's a bit bitter. It's not. It doesn't taste nice. But during the COVID, we tried to use that one at home as a treatment, and I think it was very successful. You
Exactly.
know, for
Exactly.
myself, I was so lucky I didn't caught any COVID-19 because I took my 3 jabs with my mom, and then I convinced my other two
Yeah.
girls to go and have it. So thank God we don't have it. But as you say, there was anxiety. Even me, I was having anxiety. I work with children. So I always think about, oh, when I have headache, I thought, I have COVID. I just assuming that. When I
Yeah.
got COVID, I said, oh, you know what, this is COVID. And then when I
Exactly.
go and test myself, it's not. So it's something there for us. And I think we're going to live with it. We don't know when it's going to go away, But the thing we have to just try to just help each other, including, the anxiety is everywhere. And, and mental, I'm surprised now a lot of people having mental issues, those days during the COVID-19. You can see somebody, he was a healthy person. You can see him talking and everything normally. But now I can see, even myself, I lost a lot of, I sometimes I forgot things, which is not me, in my lifetime. So now I can just, forgot things. And because of that fear during the COVID-19,
Exactly.
because
So that's what I'm
you
saying. The
you had
fear.
somebody pass away. Mm,
Yeah, yeah, I understand that. It's all about
mm,
how you observe, how your mindset is, the power of your mind, how strong your mind is. So that's why I bring people. There's no judge for anyone, whatever you believe. Your belief is the only strength make you come back strong on yourself. The power of your mind, what you said, your mom, she's doing whatever kind of herb, whatever that's make it because she believe that herb will make her avoid her from this sickness. So whatever you believe that things will work for you, sometimes it does work for you because the power of the mind, the fear and the anxiety and everything impact in your mind. That's what actually a normal stage. For example, if you have a fear from anything, like whatever situation, you bring it to yourself. But when you have that strong mindset, nothing will happen to me. I will be fine. I do exercise. I live my normal life, and like as I said before, people who has more anxiety and depression, the people who has long term depression and anxiety, and this kind of situations impact of them triple what they used to be. These people, but the people who just get it like the people who has discovered things and they feel loneliness and they just isolated. I've tried to encourage them, like, do what you love to do. For example, it's okay. I'm staying home for 2, 3 weeks. I love to do cooking. For example, one of the ladies, she said to me, "I want to do. I'm feeling so lonely, and I'm feeling I'm crazy." I said, "No, you're not crazy. It's okay. We need to stay home." For example, I love staying home. Make yourself love what you do. So when you make yourself love what you do in a certain time and you're trying to avoid all this media and all this hassle around you, that will make you feel more comfortable, more in peace. You don't need to worry. The worry, the fear, the anxiety, the stress you're going through, that's make things worse and that's make you sick and more sick. So I always I was encourage people to exercise at home,
yeah,
to do some hobbies, whatever they want to do, doing things online. Just make yourself busy. Go for walk. Just do something always to make you health, like physical health, is active. Because even normal lifestyle, like there's no COVID now. Imagine yourself staying home, not doing anything, and you're sitting on the couch and you're feeling, I'm sick. I can't do this. I can't do that. You become like that. So the main things you need to feed your mind. I'm strong even if you're sick because the power of the mind is affect you physically and mentally. It's so important. It's so important to reach people who you love. It's so important to have that community. I believe there's one of the country people they live for 180 and 100 and 108 and 90. This is the youngest one, 80 years old. Why? Because of the community connection. Because people they care for each other. People they all socializing connections. um, uh, 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 Surround yourself with other people who you love to be with, like with you. And when you come from your country, you all these people around you dancing, you're doing things together, you're doing like you don't feel that stress, you don't feel that depression. Why? Because you don't have time for that.
yeah,
Loneliness is killing, and all this media it's manipulating you. So to stay safe, do what you need to do to protect yourself from the virus, from the stress, to reduce your stigma, to reduce your anxiety, to reduce all the impact from whatever you think. Like it's three things: thinking, feeling, and reacting. Whatever you think, you feel and you react. You feel sick, you think you are sick, you feel sick, and you react sick. So the power of the mind is so important. Connection is so important. Even talking to people, even
yeah,
spend time talking to people in that time. Don't let these things impact on you because you believe is so important who you are.
Could I add something?
Yes.
Yeah, good evening, everyone.
Yeah.
What I can say, the time the COVID-19 start, I think I like to see in the media, the first start from Italy and America. When I saw them, I was very shocked because I can't sleep at night. I'm thinking about what is that, something like that, like to catch somebody and somebody was passed away straight away. It was very fast when they come, the first time. When they start here in our community in Australia, because our people they like to do gathering. When somebody pass away, they will come to one house of people, and they don't know about COVID-19 that time. Catch a lot of people. What I did, I make myself like a counselor. I cook for them. I call them on the phone and I talk to them. Do this and do that for yourself, also to help yourself, and don't think about COVID. I used to talk to them all the time.
Good.
But for me myself, I didn't get the COVID-19. I will thank God for that. Even my daughter and my granddaughter, the COVID catch them in the house, the same house. And I used to put the mouse for me, and I told them to put the mouse for them. We sleep with the mouse at the night. And then the morning we get up, same thing. We can take out the mouse. We used to put it there.
Yeah,
And I
you did.
didn't get it. In the same
Yeah,
house. I didn't get it.
yeah, that's right.
I,
Why?
yeah,
Because
yeah,
yourself
because
well.
I protect myself a lot. And I will thank God for that.
Self-talk is
But
so
the
important.
COVID, yeah, the COVID, I think for our community, they give them like mentally, they give them anxiety because everybody thinking. Even now they took the vaccination. They still worried about COVID. They tell people like when you take the vaccination, you will not feel comfortable. You know, you will feel like you still sick because your body is not feeling good like before. This is the way now the community is thinking
Yeah.
about COVID-19. Even though didn't catch you and you take the medication, you take the vaccination, you still thinking about the COVID. The one not be like that. Even you have a headache or you have a body pain and everything, they will think like the vaccination is the one affect people. They talk about that all the time.
So it's come back to
This
what?
is
Come
so
back to
yeah,
your mindset. Yep. The
yeah,
power
yeah,
of your mind, how you
yeah,
believe, how you
yep,
can react, and all this
yep.
stuff. As I said before, the way you might, the way your thoughts is, the way you feel, and the way you react. So in normal days, like if some people they were from spiders, for example, oh my god, if they see in a dream they get anxious and they get depressed and they have that fear and panic and all this stuff. So all this is infecting people mentally. Yes, I understand there is a virus and we have to avoid from whatever, like protections from mask or sanitizer and all this stuff. At the same time, we have to have a strong mindset. This is the most important things for your mental health. But in normal days, your mindset, if it's strong, your body's strong. And the connection with the community, connection with the people, socializing, exercising, eating healthy. You have even, I like that, the dancing things. That's when I went to that meeting. People sometimes they reduce their depression and anxiety with singing and dancing.
Mm,
It's kind of
that's
meditation.
correct.
So you have whatever meditation you can use to feel happy inside of you. When you feel happy, nothing will affect you.
That's
So
correct.
I think your community is so strong community and you have so much belief. And I believe you came from background, you have so much connection to each other.
Mm,
And that's we never felt the anxiety and depression and stress and anxious. You never heard about this before. But now the that all the media and all these things, it's affecting people's life, and it's a brainwash. That's the main things about people. It's about anxiety and depression, and a lot of people actually it's work on it. There is a lady. She said, what I want to do. Said, I love cake. I said, okay, why don't make cake? She said, financially, said, okay, if you're good with making cake, just make cake, put it on a website. And there's a lot of people, they can't afford to pay too much money. They can't afford to pay maybe how much you wanna sell the cup of cake. She said, it's a good idea. Make yourself busy during the pandemic, during the COVID. So a lot of things we can do to avoid all these problems. But the main things, that's a temporary time. It's not going to last forever. And whatever affects us now, even not COVID, like COVID is around, it's okay. But now, if we want to feel like anything will impact on our health, we make it worse if we think negative. We shouldn't think negative, positive. Believe, believe in our health, believe in our mind, believe in our thoughts, what we're doing, and the connection, and be happy with it, with surrounding, socializing, exercising, eating. All these things just make it life changing. Like any negative thoughts or positive thoughts. I'm not sure if that's helped any one of you guys.
Yeah, he does. Yeah, he does. He
It
does.
does. It is well because whenever you believe in yourself and believe in your mind, what your mind telling you, it happen. If you believe in bad thing, it will happen. If you believe in good thing, it will happen. Like when the COVID-19 pandemic came, I was actually in the very busy way because I'm a health background. I work in a health background. So when I work, I don't scared about COVID-19 because I
Yeah,
always in front line. So when I go there to work, I don't scared about it, and I never get sick. But after I get sick this year, when I get COVID-19, I even didn't believe it that I got COVID-19. But when I saw it, when I do my test, I believe I have it. So although it was really severe for me, but I did not take it heavy because um, what I said before, our community is very good community.
yeah.
We have they help. We get help
Support you.
each other,
Yeah,
supporting ourselves.
Well,
It is very, very, very important. And
yeah,
that what we need to say connect. Even though I'm inside, I have to talk with my friend in the phone. I
yeah.
have to chatting, talking a lot, and saying what happening and all these things. You see, also reading the book is helping a lot
Of
because
course.
when you're making yourself busy, even though you don't come out and travel with people, it help you. It help
That's
you
correct.
and take your mind away from whatever you feel or whatever you think
Exactly.
about it. It take you away from that.
I
So
want to give you an example for this, what
to
you're saying
those
exactly. Mm,
yeah,
yeah,
to those who feel like when you have COVID-19, you feel you go through depression, through anxiety, and also for young people. Last time I can see them because they have a good connection, they have good supportive, they support themselves a lot because
yeah.
whenever they have this thing, they don't think even there's any COVID-19 because they just take it very, very easy, very lightly, and they don't want that one. They don't want to think about COVID-19. They don't feel COVID-19 is real
I want to
because
ask question. Yeah, sorry, just I don't want to interrupt, but a little question. I would love you, all of you, to answer this question. People, they going through war and they can't eat, and they're feeling hungry, and they don't have shelter over their head. You reckon these people, they think about COVID-19? What they're thinking?
No,
Is
for me
I
they
anyone
don't
don't
they're
think
even
probably thinking about
Um,
this.
I don't think
Yeah,
I don't think they're thinking
yeah.
about it
They
because
don't think about yeah.
they're facing war. So I think the COVID-19 is not really a
and none
serious
of
thing to
them
think
get sick?
about it.
Why people didn't get sick in this war? And these people,
they
they
don't because
got COVID everywhere.
They don't think about it because what they're dealing with in front line is heavier than COVID-19. What the way they're seeing it is heavier than COVID-19 because COVID-19 is nothing for them. But what they're dealing, they're shooting themselves and they're having the what is it called?
The crisis
They're
they're going
having
through the face.
The girl.
somebody fighting with them in front line. So
That
their enemies who looking for them, that's the one in their mind.
work, you come back to the mind.
Pardon?
Because come back to the
Yeah.
mind, the mindset, and how powerful the mind is.
Yeah,
Because the
I said
COVID-19 is the last thing, think about it.
somebody in their mind is
Exactly. We don't like, didn't think about COVID.
yeah.
I'm thinking I want to eat. I'm thinking I want to just save myself and my kids from the war, from the bombing. I'm running away just to find a shelter or something that
A shelter.
can hide myself and save my family. They didn't get sick. Why? Because they don't think about it. They didn't make
That's
it as a
correct.
major things in their life. They're thinking about how to save themselves because they want to just find something to help support themselves from something harder than what's going now. For them, it's nothing. Why? We don't think about it. They didn't put it in their mind. They didn't say, "Oh my God, I will kill this one will kill me, or that one make me sick, or this and that." They didn't think about it completely. It's not exist. I didn't get sick. Imagine what is the thoughts, the people what they're going through, how much impact on their life on their body.
What I know, the first time when the COVID came, everybody was worried. But after they know who is the COVID-19, in that time nobody worries anymore. Because when
During
they don't know the sickness, they was worried because they hear like the COVID-19 when they come to the house, everybody will sick and everybody will die. This is the way they took it before. But
exactly,
after, it's all right. Everybody
exactly.
have experience about that. Yep. Yeah.
Yeah, well,
Yeah.
I have contact with people from overseas. They're going through crisis in their life, normal crisis like not COVID, and they have COVID in the country. But said COVID, what are you thinking? But I wish if COVID come and kill me anyway. There's more things that I'm thinking about more than COVID. I want to just, I want to feed my kids. And
Yeah.
these people, they never get sick.
Yeah.
I think to also add to that, I think like when COVID first started, like there had been a lot of like in different, for example, Italy or different parts of the country, there had been a lot of deaths related to COVID-19, and I think the beginning was a bit really tough, like globally for everyone, as it was a new thing, and people were dealing with and trying to see what the best solution could be, like until they had to come up with the vaccinations, which have now kind of reduced the COVID deaths like as they were in 2020.
Of course.
Mm,
We're not saying there's
yeah,
no virus. We're not saying there's no
yeah,
people have been died. We're not saying there is a virus. But what we're saying, how strong you are, that virus will not
mm,
affect you too much, and how much you
yeah,
can reduce this virus to your body and to your mental health.
yeah,
But the viruses exist. But there's
yeah.
more, like
So it
there's
all,
more things take our mind away to think about more than how much, when someone facing war, and guys, I know that's a lot
yeah,
of families that went through this. They're facing more than what they're going now. It's the viruses exist, but they didn't put it in their
Yes.
mind. That's what worry me. That's make me sick. That's make me this and make me that. Everyone gets sick. I'm not saying no. There's a
yeah,
lot of people that immune system they're very weak. Sometimes they target some areas, and that's they get sick. And that's why a lot of older people in Italy they died during the virus. And a lot of people they have weak immune system, they affect them in a way, but they survive. But you still we can say any disease is a coronavirus harder than cancer? Is the coronavirus harder than other HIV? There's a lot of
no,
diseases, but it's come back to the human being mindset, how strong they are, and they believe in nothing will kill them as long God you want to take them from this world. Yeah, they might go through the crisis, but they survive. And I think
that's
everyone
true.
has his own belief about it.
Yeah, and it all comes down to the mindset
Yeah.
and self care.
I just want to add as well, Wendy. We have to protect ourselves as well. We don't have to forget about, we don't have to protect ourselves. The mindset has to be, there. need to think about it. But coming to another term as well, we have to protect ourselves and know the corona is still there, still outside there. We have to
Of
live
course,
with it for, forever until whenever, it's going to get the cure because the cure is still not there. It's just like, the vaccine to protect ourselves, but what to take it out, we haven't found it yet. And also, because of connection of South Sudanese community, I think that's why we got in trouble last time. I think you saw it on the news when they said African Sudanese, against the law, they're always gathering. I think you saw that one, talking about, some migrants, we are still gathering during the coronavirus that time. Not because we don't know and we don't respect the rules, but because of uh, bondage between us. We have a strong love, a strong community. And then in traditional culture as well, if someone pass away, we have to be together
of
to
course,
support them. And then that is the way they feel love, If
of course,
something bad happened to you and then you don't have any visitors around, it doesn't look good. So,
of course.
and that's why last time we got in trouble, and as well, people got in trouble because of, trapped, the COVID-19. Some people I know, a lot of people pass away. They went to that, we call it bika, gathering, and then they got COVID-19, and some of them die on that, gathering time. So we
Yeah,
have to be aware as well. We have to just say, mindset is there, and as well, we have to protect ourselves. We don't
exactly.
have to be, not doing the mistake thing because yeah, we love each other, we're a
Of course,
community. We still have to just call and say, how are you doing, my sister, my brother, how's the kids. I think that one is just a lot for me. If I got somebody calling me to say to check on me, I would love that, rather than coming and see me face to face, because
exactly.
maybe I have it and you're going to take it and give it to another person. That is the thing I want to ask. So we have to be aware, and as well we have to have a mindset at the same time.
Look, um, Agya, it's so important. Look, there's no virus, there is virus. There is no protection, we need to protect ourselves.
Mhm.
So the only things they try is something happen. The thing is to avoid to spread this virus to from one to another one. Maybe you're strong, maybe the other person is weak. And if someone the main thing is imagine that's if someone he get the virus, for example, God no from you, and it doesn't affect you, but it does affect this person, and you feel I shouldn't see this person, I reach this person, I know I have that COVID, and if something happens to that person, it's about the feeling towards this person. It's not about the law. It's not about anything else. It's about you, how you feel. Said, oh my God,
Mm,
I delivered this virus to this person. I feel so guilty. If something happened to him, I feel I shouldn't see him. I shouldn't do this. I shouldn't do that.
mm,
Even my mom, I can't see her because I'm scared. If I want to,
mm,
because everyone's different. They have different body. There is
mm,
virus. We can't say there's no virus. But the thing is the law. It's about not spreading this virus, not take it from person to another person. You don't know. You think that it's oh there is not. I have virus. I have virus, but nothing happened to me. It doesn't happen to other
mm,
person. You don't know because look for Monica, she gets severe sick. Why? Because she didn't handle the virus. She went through this. She believed it after she gets sick. So that means there
mm,
is virus. Like, yeah, see, there is. But to protect ourselves, just to avoid to spread this virus to other people. I'm
mm,
not talking about the virus and COVID. It's not my area. I'm talking about the guilt, the feeling, the mental issue that's impacting you if someone catch it from you.
mm.
Mhm.
And to protect your community,
That's
to
correct.
protect yourself, to protect other people. So when we do that, to avoid connect with these other people when they have diseases or you have
Mm,
that disease. That's all. It's about humanity. It's not about law or anything else. It's about how
mm,
to
mm.
protect your community from yourself first before anyone else.
That's correct.
Yeah.
That's correct. Yeah.
Yeah.
Yeah. I do agree with you. That's correct. Yeah.
Yeah,
Yeah, like me,
yeah.
I just add, I will
Do you
just
have
add
any
I will add the last
point?
one, Wendy. I will add the last point. When
Yeah,
I was, because
yeah.
I'm a support worker as well, during the COVID-19, I went to support one of my client, and I didn't know, they haven't told me about, they having a COVID-19 in their house. And I was there until I left. When I left, I found out that they, been affected. And I was so, so concerned about my family. I was having a
Of
big gift,
course.
you know, about oh why
See?
do I do that?
Yeah.
If I just blame them in other way, and either way, you know, I didn't blame them because
You
they
have
don't
right to
know,
blame them. Of course. Of
you know.
course.
So and then when I came to my house, thank God, thank mighty God, I don't have a virus, and I didn't brought virus to my family. You know,
Yeah, good.
I didn't know that
Mm.
if I have it, I'm not quite sure what would happen to my elderly mom because that is the only person that time I was concerning about her,
Exactly.
you know,
Exactly. Yeah.
and I
Yeah.
wasn't forgive myself if something bad would have happened to her.
Yeah.
So, you know, that is the thing happening sometime, but we, you know, thank God for that way.
That's what
So it's
exactly
happening
what we
sometime,
yeah.
you know,
That's what I'm trying to
mm,
bring you to this part. Now about the community. If I want to protect my community, I have to protect it from myself, not because of the law,
myself.
not because of anyone else, from myself. Because if anything happened to that person, I feel guilty all my life. I can't live with
That's
this.
Yeah.
correct. Yeah. Mm,
Yeah.
Okay? So don't worry about the law.
yeah.
Don't worry about anything else because the viruses exist and it's happened and a lot of people
Mm,
died. So what the law
mm,
is doing, it's okay. Yeah, we accept, we follow the rules because we don't want to hurt ourselves. We don't want to hurt our community. We don't hurt our
mm,
loved one. And we all did that. Me and my mom. I will never see her and I love to see her and I'm worried about her. But if anything happened, if I maybe I get the
brought
virus,
it.
but
Mm,
if she got it, I will be guilty all my life. I will never
for
do
all,
that to
yeah.
her.
Mm,
That's the only reason. Don't worry about the law, my dear. Worry about just you to help yourself and help others in your community to be safe. That's all.
that's correct. Yeah.
Yeah. I want to add
Mel, do
something.
you have? Yep.
Yeah, I
Okay.
have something to add. During COVID
Okay.
19, everyone was affected, was full of stress and disease, sickness, you know. And we try our best to counsel them. A lot of South Sudanese mothers, they become counselors in the community. We
Yeah,
counsel them that coronavirus is like malaria because in Africa we have a lot of malaria and we don't know where malaria
yeah,
came from, you know. So
yes.
we tell them it's like malaria, so it's coming and it's going away. And
Good on
malaria
you.
is still there now. It's a lot of years, you know, in
Mm,
Africa. So, but we don't know where malaria came from. So this is what we advise to them that please control yourself. And like I myself, I get affected for coronavirus in my auntie house because my auntie she was really sick and she called me to say, Neil, I'm really sick and I'm not feeling well and no one look after me. So I said, okay, I will come. I take my children to my mother-in-law house for in case if she can, you know,
take
affected
care
all
of.
of us. You
Yeah,
know, so I take them to my mother-in-law house and I went to the city. I shower her and make her fresh shorba, you know. And she's like, no, you know, this coronavirus is too much. Just leave me and all this. I'm like, no, I have to look
yeah.
after you. So after that, I get coronavirus. Then we stay together. But I'm very young and I'm healthy. But she have a-
Health issues.
diabetics. Yeah, she have diabetics. So it's
Yeah.
hers one is really worse until 2 weeks and she's getting worse. She end up in hospital but I myself, I treat myself at home. I take Altivin, like this medication,
Yeah.
this medicine,
Yeah.
and after 2 days, I feel my body, you know. So after I take this medicine, I have a lot of, you know, I get cold and I feel my body. So I
Mm.
call my community and let them know that this medicine is help for coronavirus. And I went live video. I showed them what I test during coronavirus, and they get it, you know, and it's really helped that time. So during coronavirus, what we need in the community is, you know, counselors. We need to counsel everyone
Educate them.
because they think
Educate them.
coronavirus is killing people quick, but it's not. It's
Exactly.
like malaria,
Exactly.
you know, it's like malaria. And back home in Africa, we have malaria and we control ourselves for it, you know. So
Exactly.
this is what we
Um.
tell them. And secondly, like medicine came like vaccine, and they
Mm.
don't want to do it because a lot of people when live video they say you will die in 5 years, 3 years, 2 years. You
Mm,
know, I tell them no. It's like yellow fever. If you're going to overseas, you have to inject yourself for yellow fever. So it's the same yellow fever reaction. So don't scare. Just go and get it. You'll be okay. You know.
You know, we have vaccine for many diseases when we were young, and
Yeah.
it is
Yeah.
none of the diseases as well as spread. So it's what's
Yeah.
the difference? There is
Yeah.
disease, and we
So
have to protect
yeah.
ourselves. You know what I mean?
Yeah. So after we all get injection, everyone is safe in the community. Like if you get coronavirus today, it's not affecting you like the way like first start,
Used to
you
be.
know. So you get sick like very hot for 2 days, 3 days. After that, you recover quick.
Yeah.
So, but thank God, coronavirus is still there. This is what we tell community: coronavirus is still there. It's like malaria is
Educate
not
them.
going anywhere.
Yep.
You know,
Yep.
it's not going
Educate them.
anywhere. We just need to forget about it. We don't need to
Now we're
put it
gonna
on.
live with it.
Yeah, and take
It's
care of
okay.
yourself.
Educate them
Clean your
about it.
house. Spray like
Educate them
Glen
about
20.
it, and
Yeah,
yeah, educate them about it. Educate
yeah,
people about it's exists. It's killing people, and to protect them. Said to anyone, as I said to Agia, I said, you don't want to feel guilty if someone catch the virus from you. If anything happened to that person, mentally,
yeah,
how you feel. So
yeah,
not everyone the same body. Everyone have different body, and everyone
yeah.
have different reaction.
Mm-hmm.
So that's why the only things we think about how we want to protect the loved one.
Yeah,
It's not about anything, as I said before. It's not the law. It's something exists as something is killing people.
yeah,
It's all right just to educate these people
yeah.
how to protect them and how to follow the steps. That's all. That's all.
Yeah.
Yeah.
If we didn't say this,
Also, I just want to add
yeah,
something like Wendy said it before about stigma. Bad stigma to our community. I can pick that up because it is true. Because some people with coronavirus, uh, they feel that they have stigma that they live with
yeah.
them.
Sorry, I've charged my computer because it's died. Yeah,
Mm. So they don't want to speak up. When you get sick, you have to show yourself that you're sick and
yeah,
let other people get aware about it, because to go to interact with people, you get, as other people said it before, some people they can get their immune system is very weak. And
yeah.
when your immune system weak and and this person who was sick, his immune system is strong, that one will affect that person. And I just want to advise our people, because sometimes when your immune system is strong, please don't say that my immune system is strong and the other people will be like that. No, because
No,
the way we
no,
take it actually, for us, sometimes we feel like we very strong, and the coronavirus is nothing for us. But in somehow, some people, their immune system is not as strong like you. So
exactly.
you
It's
have to
different.
control yourself and stay home and to protect other people. And that's why whenever coronavirus affected me, I never go out. I will never go even any social life thing like go outside to meet with other people. I will never do that,
Of course.
because I start from my house. The way I feel
Exactly.
to my family, that's the way I can feel to my community outside, or
Exactly.
anybody that can going to meet with me outside there. I don't want them to get infected. So for
Yeah,
us,
of course.
we have to control ourselves whenever you get sick, because some people they take it as just normal flu. Because when you have a flu, you can say it will not catch other people. But then
Yeah.
somehow, if you are a good person, you have to protect yourself. Even though it's a flu, you have to protect yourself from that flu so that you cannot give it to other people. So that
Exactly.
in that way, we will be keeping ourselves safe, and you
Exactly.
also help your community. So in our community, we have to take precaution a lot, because we need to protect ourselves a lot. Whenever you get
Yeah.
sick, stay home, isolate yourself, and be in your place, so that you cannot give some people
Spread.
sickness. Because when other people take it, as Wendy said it before, when you give sickness to other people, you feel
Exactly.
very, you feel very, very, very,
Guilty.
very
So
guilty all the
exactly.
time. You
Yeah.
feel guilt all the time, because whenever, especially when someone went and passed away, you will never be happy in your life.
Of course.
You will never be happy in your life because you will feel guilt all the time. Why did I meet this person and he went and get sick and his sickness went and killed
Yeah.
that
Yeah.
person? That's not good. So we
Of
have to
course,
be
Monica.
very
Caution.
caution for coronavirus. It's not it's nothing. If we're coming to the reality, the way you take it, you take it away from your mind. This thing is nothing, but think about other people,
Exactly.
because when you take it lightly, you take it lightly for yourself, but don't take it lightly to other people,
For other people.
because
Exactly.
you need to
That's
be
what
careful with other people.
exactly. Yeah. That's
Yes,
what just
because
because I'm not that's the coronavirus agent. I'm just a mental health worker. I'm working with
yeah,
people when they're going through coronavirus, how they can protect themselves mentally and physically. So
Yeah.
it's about connections with others and stuff. You know,
mhm,
everyone knows. I don't want to hurt anyone. If I have the virus, whatever, even flu, as you said, I don't want anyone catch it from me. I don't want him to
yeah,
get sick. If something happened to him or to them, I feel guilty all my life. I know what's happened. So I stay in the same rules. But no one can say there's no virus. There is virus. There is people died. There is
yes,
something. So we have to protect ourselves.
yeah,
I'm trying to say other country, they don't have, maybe they don't care about life anymore. Maybe they don't care people they go on facing war, facing whatever crisis in their life. Maybe they have coronavirus. Maybe they have a lot of things, but they don't care about their life to stay alive. You know what I mean? So that's why they don't care about
Yeah.
protecting themselves. So the crisis they're facing
And just
harder than what they're going through.
not to interrupt, just when you finish, I also want to share with you all some experiences I've had with COVID, like as a parent. But when you finish,
Yeah, yeah, I'm finished. Yeah, yeah.
Yeah, could
okay.
I add something, small things? Uh, because to protect the people is very good thing to do it because the coronavirus is very fast. It's go around very fast.
Yeah,
Like
that's right.
like when I become the first contact because I went to the clinic and I got somebody there who have a corona,
Mm-hmm.
but but the department they closed the clinic and they said everybody was there. They sent them a text message to tell them you are a first contact. You don't have to go out or to go around.
Yeah, isolate yourself. That's right. Yeah,
When I hear something like that, I will stay in my house and I will use mask all the time in the
good,
house
good.
because I
Yeah,
don't want I don't want to give other people to give them sickness because when you give somebody sickness will be like if you have strong immune, somebody else they don't have a strong immune or maybe somebody else is sick, have a problem. When they catch
yes,
COVID-19, they will be worse, will be sick,
exactly.
very
Yeah,
sick. When
yeah,
something happened to her or happened to him, they will blame you. Why you know yourself you are sick and you become around the people? You have to
yeah,
keep yourself away. Yeah.
exactly.
Thank you.
Yes.
Yeah.
Yeah, I'm just I have
Yeah.
another. I want to see client around 8:35, so just I have 2 minutes if
Yeah.
it's okay. So yes, Ian.
Okay. Yeah. So I'll just share quickly like some experiences I've had with COVID as a parent. So basically, my little one, she's now 4, but when she was 3, she had COVID. Towards the end of December 2021. So she got very sick and she was in ICU for like 2 to 3 weeks. At first they weren't really sure what was the cause of her sickness, which is basically PIMS COVID, PIMS TS. That's what she had at that time.
Yeah,
So she had COVID like let's say 2 months before she got really sick, and then she recovered. She didn't have any symptoms. I didn't know she had COVID until December 2021. She got really sick, and I had to take her to the hospital.
yeah,
So she was in ICU, and as a result of COVID, that that led to her body attacking the COVID in her body after she recovered, causing inflammation in her body.
Wow.
So that's she had the PIMS TS, and yeah, so she was in ICU for 2 to 3 weeks, treated, and then after she recovered, she got home. So it was at a stage whereby she couldn't talk, she couldn't walk. She had to learn how to walk again and talk again. So
Yeah.
it was a bit of a tough time for me at that time as a
Of
parent,
course.
but surprisingly, I never got COVID myself. So I was like, where did she get it from? Because I was doing work placement, studying online, coming home. I wasn't going out too much. So I'm like, okay, how come she got it, but I didn't get it? But
Yeah.
I think at that time I
Yeah.
had to just accept the reality of what it was and just do the best I can to help her recover and all that. Yeah, but she's okay now, active and all that. But due to the COVID, she's been on aspirin for 8 months now, and then
Yeah.
she's currently on aspirin for the next 6 months. Because I don't know, it's kind of like it's affected her during that period, and she's
Yeah.
recovered. But on the long term, she's on medication because of because of the COVID and all of that.
Yeah.
So yeah, just to do with her heart
Of
arteries and
course.
that, she has to be on aspirin for the long term. Yeah, so that's the experience I had as a parent with
Of
COVID. So
course.
at
Yeah.
first I
Yeah.
used to be like, oh, I'm not taking the vaccination because I'm not really sure what's inside the vaccination. Like, but then when she got COVID, I'm like, I have to take the vaccination because, like, yeah. So that
So
was the
that's good. We
experience I
don't.
had with
Yeah.
it.
So that's his experience and Monica's experience. It's helped other people in your community to understand there is COVID and there is
Yeah,
effect, and it might affect people health wise. So it's all these things. It does help people to educate them about there is coronavirus and there
yeah,
is like things that might impact on us, like your daughter and Monica's health, and everyone's going through this. So it's all right.
yeah,
Look, why we take it a big deal? Just do what we have to do to protect
mm-hmm,
ourselves and not hurting other people.
yep,
That's your experience is so important for other people as well, to support them, to educate them, to tell them that it's like any other diseases, whatever, malaria in Sudan or wherever. We need to take this vaccine for to protect ourselves. And as I said, you have a good buddy, your daughter, she's going through maybe she was her immune system is not good, strong enough, so she get this
yeah,
virus. You know what I mean? So anyone he can get it. To just to be in the safe side, we need to
just
avoid all
protect.
this hassle, take the vaccine, protect ourselves, not spread it to other people, and educate them. It's not about
Yeah,
anyone, it's not about community, it's not about law, it's about anything else. I understand your situation and your community, but it's about you guys. Because you love each other, you care for each other. So that's the important things, to support each other and educate them about coronavirus.
yep,
That's right. I just want to add a small thing also about the young people. I just
yeah,
want to talk about youth because we're young people also. They still is scared about COVID-19. A lot of young people, they
There is a
refuse
lot, yeah.
vaccination.
There's a lot. There's
They
a lot.
refuse vaccination, and the vaccine. Uh, Use of the vaccine is effectively, actually it work because it help a lot of people, because when you get vaccine and you just imagine when you didn't get vaccine and you got coronavirus, will be very effectively, and it will be very severe for you, for the person who did not. I can give example. My auntie who was just uh, a victim of COVID-19. I don't like to talk about the way she was being
Yeah,
sick and the way she died. I don't like it, but it was not a good thing actually,
yeah, yeah.
because he just got it when we have uh, our our cousin who passed away, and then my auntie came, and she got that virus. When she got the virus, she was very severe for her because she actually had one injection, but it
Yeah,
doesn't help. It did
yeah.
not help because she was sick until he passed away, and it was very sad for us.
I'm
It's a
sorry to
person
hear that.
that
Yeah,
it was a person that he could not be passed away by COVID-19 because he's very strong woman, and it's really bad. I don't like it,
yeah,
but in the case that people refuse injection, the vaccine, is not good. But when you get vaccine and the COVID, you get infected by COVID, it
You
will help.
recover. Of
It will
course.
cover you. It will
Of
help a lot.
course. Yeah,
So
it's about
I
70% of the whole world. Yeah.
yeah, I actually encourage young people to get vaccine because getting vaccination is not bad. You can put it like other vaccine that we had years ago.
Yeah.
As for us, we were being vaccinated when we were young. We don't know even we're being vaccinated, but you can just see the what is it called, the lump of the thing, the vaccination, like
Yeah. 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 I understand what you're saying.
you
Yeah.
can see it in your arm where you were being injected where you were young. You can
Mm.
see those things, but
Yeah.
he did not kill you, did not do anything. But
Exactly.
COVID-19 came with worried anxiety, all these that scare you in your mind, that when you get injected, you cannot give birth, you cannot do
It's
this,
all about
you
mental
can
things.
you
Exactly.
can do like. Those are the worries. The people
Exactly.
scare people in different ways so that you cannot get
Different
injected.
ways.
But
Yeah.
if you get injection, the way you get infected by COVID-19, it cannot be worse like if the person cannot get injected. So
Yeah.
I actually urge young people to get vaccinated because it help a lot. It help a
Exactly.
lot because I find it, I myself, when I get phase one, when I get COVID-19, because I got COVID-19 when I actually injected. I take all out. First one I take 2 doses, and the second one I take the third jab. So I couldn't get any infection anyway.
Yeah.
I cannot come very severe like the way other people got it. So injection is really very good. Vaccination is very good. It help a lot. And I even when my kid were just refusing, they don't want it because they're still young, and they say, "This is, you don't know, mom, what you're going through. This one is not good. We will do this and we will do that for you." I said, "No, I decided I have to do it because I'm working and I don't want to get sick. I don't want to lose my job because of COVID-19. I want to. Government cannot kill people. It cannot kill people with the COVID, with the vaccination. When
No.
they bring the vaccination, they know what
We all
happened. I
vaccinate. We all
and
vaccinate. We all healthy. Yeah.
everybody get vaccinated. Even
Yeah.
all these leaders, they get vaccinated. Why
Of
us?
course.
Why we don't getting vaccinated? Why? What is
Yeah.
it? What is very special about us? So
Yeah.
I
Get
don't
it from here.
think
Yeah.
you have to get vaccinated because to protect yourself and protect other people, you have to get vaccinated. Afterward, they
Yeah.
accept it. They just came and get vaccinated. So
Of course.
vaccination is really very important. And also, what I get also about COVID-19, when you have COVID-19 and you have shower with a hot water, it help a lot.
Exactly.
And I
All
can
right,
see
guys.
when my
Yeah.
auntie was in the hospital, they open aircon, which is the cooler, which is really bad with the COVID-19. It's not good actually. When you get COVID-19 and you sit in the place is very cold, it get worse for you. But if
Yeah.
you get a warm place, it's really helpful, very very helpful. So
Yeah.
for me, I get shower myself with the hot water, and then I get sweating a lot, and I
Yeah.
won't get like
Let's
2 days,
help you.
3 days.
That's
I
good.
get
So
help.
happy
So
seeing
thank
you,
you
Monica.
very much.
Healthy and happy. That's the main thing. Here you go. You're
Yeah.
here,
Yeah.
and I hope Ian's daughter as well. Thank God, she's healthy now, and everything's whatever you're going through.
Thank God.
Crisis. It wasn't easy for you guys. So all these things, let's give you a listen. That's to help the loved one and the community you love and all the people you care about. And imagine if the leader have the vaccine. So what about you
Yes.
Mhm.
guys? So the leader,
That's correct.
yeah, yeah.
Yeah.
So
Just
That's
to
love
correct.
to
Thank you.
see. Yeah,
yeah.
sorry that. Sorry, Ian.
Right. Yeah, just to wrap up, like with the time, I'll just share with
Yeah,
you. Thank you all for coming to attend this session. All your views and thoughts and ideas were all valued today. And it's important. It's very great that you guys helped also create the awareness for the other people in the community or outside. I just want to maybe share with you guys the steps to protect yourselves and others, though we have probably discussed like some of the steps, if that's okay. Like, yeah.
Yes, of course.
Yep. Okay. So, to protect ourselves in the community and society is important. Even if you don't get COVID, you still help to, not spread COVID and to protect yourself and other people. So we have 6 steps here to stay ahead with COVID, like this summertime. One is wearing mask. High quality and well-fitted mask can protect you and others from the virus. Get your booster dose. There's a new bivalent vaccines targeting Omicron variants are available at your GP or local pharmacy. So to find out if you're eligible for the next booster, visit the coronavirus website. Let fresh air in, like always open the window and doors when you can in your home and to reduce the spread of the virus. Get tested if you have symptoms and take a rapid antigen test. And even if you don't have symptoms, but if you work in healthcare or aged care or childcare, like any of these public sectors, always test yourself every day if you can, just to be safe. Stay at home if you get COVID. You should stay at home for at least 5 days or until you have no symptoms, and then talk to your doctor if you are at the risk of falling very sick. You may be eligible for COVID medicine. And other things that you need to do is also to report your rapid antigen test results and find the nearest vaccination provider through Vaccine Clinic Finder. Information of antivirus and other medicines to treat COVID. So that's all I wanted to add to the session, and thank you guys for attending today's, for your time and for attending.
Thank you. I hope
Let's have
everyone's enjoying his webinar. Yeah, thank you so much.
Thank you, Wendy. Thank you for
Lovely
all
meeting you all.
information and advice. Have a good night. Bye
Okay,
No
bye.
worries. Be safe.
Bye.
Bye,
Bye. Have a good night. Bye.
see you.
Bye.
Bye-bye.
See you guys.